Well, the introduction from Kat Smith was a little bit disappointing, but it was brief, which was good. And then the speakers, the MPs that spoke about their concerns with the international health regulation amendments or the proposals for these amendments, they spoke really well, and I was really pleased. I think I can speak for the people who were there in the public gallery that they really seem to grasp the issues. Now, the same could not be said for the two speakers for the government, the Minister of Health and the other lady, and they really didn't seem to grasp the issue. They didn't seem to know the difference between the WHO Pandemic Treaty and the amendment to the international health regulations. They didn't seem to realize that the one related to pandemics and the other related to all sorts of public health emergencies of international concern. So, there were these key things that clearly they didn't know enough about. They knew very little about. And they seemed quite content to just keep reiterating that, no one's safe till everybody's safe, and these documents, the IHR amendments, won't have any impact on sovereignty, and they would never let any document go through that impacted sovereignty. But it was all very vague, without any substance. And what was clear is that they seem to not really know who's negotiating this for us. They don't seem to know. They don't tell us how big the team is. There were a number of requests for them to say who was negotiating, but no, there's no information on who these individuals are who are taking, responsibility for our sovereignty, representing us in these things. They couldn't tell us what amendments they would never allow to go through. For example, the ones, the 13A, which is the one which says that we will follow WHO recommendations without delay, or the one, or Article 1, which indeed removes the word non-binding. So they just sort of blustered on about that they would never allow it, but they didn't give any specific points. They didn't address any specific points about which amendments they would never allow, or that they were adamant that they would oppose. So it was pointed out, I think Andrew Bridgen pointed out that at the end that it seemed very much like they were that there might be a lack of leadership on this to some degree. Not only that, but that there might be something, nefarious going on that we can't seem to get these answers. So, I think we just have to keep pushing for answers. We need to know who the negotiating team is. We want individuals who understand what they're doing there to come and explain to the public and engage us. There was nobody there apart from the Minister of Health and I don't know the other lady's name, but who were there to shed any light on the information at all. So you have to remember as well, this was called a non-substantive debate. So there was there's nothing that goes forward from this. It's just sort of a bit of a theatre, a little bit of a theatre you can come and watch, and then it goes away, they hope. So I think it's really important for the public to note this, and we cannot let this go away. We have to keep on standing up for this, because they don't know what's going on. There's nobody driving this bus.